Hello, everyone. My name is Mary Bautista, and today I'm here to discuss how to improve the quality of clinical setting services to achieve better health outcomes through safe practice and effective communication. There are many factors that can affect your health, whether it may be the earning you receive, access to services, or where you live in, can take a toll in the way you are taken care of through the healthcare system. Aboriginal and Torres Strait Islander people from areas of socioeconomic disadvantages, people living in remote or rural location, and those who have disability have experienced health disadvantages than other Australians, which have led to higher rates of illness and shorter life expectancy. Within their community and the individuals within it, good health is holistic, which include physical, social, emotional, cultural, spiritual, and ecological well-being. Between 2014 and 2015, it states that an estimated 40% of Indigenous Australians aged 15 and over rated their health as excellent or very good, 35% as good, 26% as fair or poor. There is somewhat progress in improving their care, but a gap still remains. For example, healthcare risk factors consist of an average having higher rates of smoking and the consumption of alcohol, exercising less, and a great risk of high blood pressure through social determinants. They have lower levels of education, employment, incomes, and poor quality housing and the appropriate access to health services. Has been reported to have difficulty in access affordable services that are nearby than non-Indigenous Australians. Though Indigenous Australians' health is slowly improving, there are still challenges that still exist as they experience socioeconomic disadvantages and health inequality. The communication between Aboriginal and Torres Strait Islander and healthcare professionals has a significant impact on health outcomes. The communication gap is found mostly in remote areas where cultural and linguistic differences are greater. Indigenous people in remote areas are found to have a shorter life expectancy than those who live in rural or urban areas. The need in understanding the Indigenous language landscape is important in improving communication because Emery states that in 2011 Australian census, 60,550 people, or 11.8% of Indigenous people, claim to speak an Indigenous language at home, and 17.5% claim they do not speak English well, which has created difficulty in specialized language with common terms such as infection, tumor, or bacteria, has been misunderstood. Misinterpretation can be another interference in communication in their culture. By providing clear instructions can enlarge communication gap and cause decision ineffectiveness. The lack of knowledge, proper and appropriate communication between Indigenous people can affect their outcome of care, creating challenges and creating negative impact within the relationship of the patient, creating challenges in the hospital, leading to non-safe practices within the hospital. As nurses, the quality of communication between Indigenous community and healthcare providers, including an awareness and interest in Indigenous culture, is crucial for ensuring that patients feel culturally safe and respected. That is because there is a higher percentage that the Indigenous community will access healthcare. They can receive the care that they need as well. Health services that value Indigenous culture by displaying Indigenous artwork and providing culture appropriate resources, communication, and other means of services can help ensure that they can feel culturally safe. These implementation lets Indigenous people feel acknowledged and accepted, and that their cultural safety is shared, respected, shared meaning, and shared knowledge. An experience of learning together with trust and truly listening. Having safe practices and effective communication can benefit in improving the quality of clinical setting services to achieve better health outcomes with the Indigenous community. As nurses, it is important in understanding the culture of Indigenous community in providing appropriate and safe information about their healthcare needs. For example, many Indigenous people do not speak English as their first language or know how to, but in a dialect. To help overcome these barriers as nurses, we can avoid using complex words, explaining why you need to ask questions, always checking if they have understood, and being cautious about traditional languages. Listening is another great effective communication as it shows empathy, being attentive of their concerns by avoiding interrupting or speaking over the person and using paraphrasing what the person has mentioned to help clarify and signal that we have been listening. By providing safe practice, health services can provide information about health/diseases, process, and healthcare that is tailored to the need of the Indigenous community, supporting clinicians in identifying consumers who have limited capacity in decision making about their own care, and help clinicians to work with Aboriginal and Torres Strait Islanders, consumers, and carers to plan, communicate, set treatment goals, and make their own decision about their health. By doing this, it creates an opportunity for Indigenous people in developing their own care that suits them and develop the resource that they need in providing proper care. In conclusion, the importance in continuing to deliver safe practice and effective communication in a healthcare setting in Aboriginal and Torres Strait Islander people, because it creates a better understanding within one another, builds trust, feels accepted, and lead to better health outcomes. It helps healthcare providers to cater the proper need of services to meet their cultural needs. Please see the next two slides for references. Thank you for joining today.